It's always the last part of it is mad rush.
Today on the menu we have fisherman's bake with golden roasted potatoes, pumpkin and green beans, and we'll be serving about 98 residents.
So this is a nice soft dessert for residents and it's very tasty.
Lunchtime at this Brisbane nursing home may look like a simple meal, but there's an exact science behind it.
I would say it is one of the most complex spaces for a chef to be working. We have residents that on average have 8 to 10 medical conditions.
Thanks for that, Rena.
Consultant dietitian Cherie Hugo makes sure meals are packed with nutrients. The residents are assessed every 6 months to ensure the strategy is working.
Here you go, love. That's definitely smart.
We've demonstrated we can turn malnutrition around by up to 44% in 3 months with evidence-based food-first approaches.
The residents of Zion Nunda Aged Care Home are loving the changes too.
I am very happy to come here and have a meal every day. It's presented nicely and I do try to have my veggies, but I know they're very good for me. And if I want to keep my brain and everything else going, I have to have that.
But not all aged care homes provide such good meals. Evidence of shocking food in nursing homes with an average cost of just $6 a day was heard at the Aged Care Royal Commission. In last year's budget, the federal government announced extra funding of $10 per resident per day. Aged care homes have to report how much they spend on food in order to get the payment.
How do you know that the $10 will actually filter through to residents and it won't be put in the pockets of aged care providers?
We're putting hundreds of extra audits every year. There's going to be new powers for the regulators.
But the reports submitted by nursing homes show that a third, or almost 900 operators, are still spending less than $10 a day on food. They were referred to the regulator, which audited 41 of them, less than 5%. It found 3 had failed food standards.
And I don't think without a clear audit trail, without the spreadsheets and so on, you can be sure that they actually did spend the money on this.
The reports also show most nursing homes say they are spending about $14 a day. But with more than $3 billion of extra taxpayer support being paid out, 730 can reveal the health department doesn't require providers to supply any proof of their spending, telling them, "We are not asking you to provide us with spreadsheets or evidence that supports your answers."
No, I don't think it's okay because the whole idea was that it would go to food. And so that tightness and transparency, real transparency, is to me essential.
My mother, she is a vital person and not really fussy with food, but she loved fresh, healthy meals. And so she used to say to the nurses and the staff there, "Hey, some of us have teeth."
Julia Davis says the food served to her mother Barbara at Castlemaine Health was so bad she was forced to take drastic action. She moved to regional Victoria to personally cook meals for her.
She was becoming really, really frail. She would have starved if I hadn't have been there in a way. That's how I felt.
Julia thought things would improve with the new supplement, but says she saw no change.
I took a couple of photos of the evening meals because I was horrified. I'm not precious, but there's absolutely no way I could have eaten that food.
She complained to management and the regulator, but the Quality and Safety Commission found the nursing home still met all food standards. Castlemaine Health said that most consumers enjoyed the food, however it declined to say how much it spent per day. Anne Schneider has worked as a dietitian in aged care for more than 20 years and says many homes still have a long way to go.
I see things like, particularly say the evening meal, where often cheaper or low protein items are served. Things like little pies and pasties, fish patties with not much fish in them, tin spaghetti, I'm still seeing the same issues pop up that I did 20, 30 years ago. Very often we're seeing people with very little skill and no training making clinical decisions every day about what to put on a person's plate.
It was 3 years ago, just as the Royal Commission was starting, that the federal government turned to Australia's most famous chef from the Barossa, Maggie Beer. It gave the Maggie Beer Foundation almost $600,000 to create a series of online training videos to help cooks working in aged care homes.
I want us to work towards every bite of food in aged care being equal measure of nutrition and pleasure. It is for the things that I could see that just aren't being talked about or taught in any way, because we have virtually no specialised education for cooks and chefs.
The videos were released just last month, but they're not free. Aged care homes or staff themselves have to pay $480 for the 11 modules, or $44 per half-hour lesson.
Join us for this important training series for aged care cooks and chefs.
Not every residential aged care facility is going to participate because some are very small and can't afford these things, even if it's a small price.
Maggie Beer said most of the fee goes to the production company which filmed the series, and the foundation takes a small portion to pay an online moderator.
If all 2,700 homes could have it free, if someone puts up their hands, I'd be in it like Flynn.
Labor too has pledged $5 million to the Chefs Foundation to develop new food standards and more education and training. Some chefs and dietitians have expressed concern that the skills and ingredients may be too sophisticated.
I think the videos are fantastic for somebody who is really trying very hard already to do a good job and would like to further improve. But I think there's also that need for some more fundamental training for staff who may have very few skills.
Following the online modules will give the cook or chef the basic skills. Some of the ingredients are optional. For instance, if you're making a fish soup and we have saffron in it, saffron is optional, right? But saffron is 3 little threads of saffron in it. We must give options. There are people and there are homes where food is so important, they don't want it dumbed down. And I don't want anything dumbed down, but I want everything accessible.
Cherie Hugo says extra money alone won't fix the problems of poor meals and malnutrition.
I think funding without direct guidance is throwing money away. If you haven't got the right pieces in place and you put $10 more into the food, nutrition and dining experience, it can absolutely be wasted.
Barbara Davis died earlier this year. Her daughter Julia saw how much she enjoyed a good meal and wants the same for other people living in aged care.
Well, I just remember the look on Mum's face when I'd take food into her that she loved, simple things that she loved, and her face would light up. I live in hope that it'll change because we need to respect the elderly more and take better care of them.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.